is Dr. Arianne from the Movement Paradigm. So today I'm going to talk a little bit about acid reflux. I did a post the other day and it seemed like there was a lot of interest and unfortunately a lot of people that were experiencing this particular symptom. So acid reflux, as many of you know, is a feeling of burning sensation in your chest. It's a feeling of heartburn. And if you have got acid reflux more than 2 times a week for a month, then you have been likely given the diagnosis of GERD, which is gastroesophageal reflux disease. This is one of the most common gut complaints in hospitals in the US. More than 15 million Americans experience it on a daily basis. So it is very, very common. So let's first talk about why could this potentially happen. So of course, to do that, we have to talk a little bit about anatomy. So the esophagus, i.e. our food pipe, goes right through our diaphragm and then into our stomach. Okay, so we have a hiatus in the diaphragm. We actually have 3 of them, and one of those is the esophageal hiatus. So the esophagus runs right through that area. So one of the biggest causes of reflux above anything else is going to be stress. The reason for that is that if we are in a sympathetic state, so we can think fight or flight, I've talked about this in another video, or in a freeze state, an immobilization state, which is called our dorsal vagal state, our diaphragm, one of our autonomic or automatic functions, can be affected. Many times when we are stressed, our diaphragm creates a restriction, it gets tight, it doesn't descend to allow for proper diaphragmatic breath. And that leads us to chest breathing and neck tension. So think of it as every time we're stressed or we're in a chronic state of stress, even more so, then unfortunately we are creating this tension, this restriction around the esophagus. So what can happen is the stomach acid can get regurgitated back up into the esophagus, giving us feelings of heartburn and burning sensation. So it is one very, very common cause. Another common reason is that we can have low stomach acid. So oftentimes you think, I have acid reflux, I must have high acid. That's not necessarily the case. And nearly half the people over the age of 60 have low stomach acid. So as we age, we actually lose stomach acid. We need stomach acid. It's really important to be able to break down protein, to be able to help us break down and absorb minerals. So it's very, very important. So it doesn't mean that because you have acid reflux, you necessarily have high acid. So another factor is, of course, foods. And, those are things like fatty foods and fried foods and tomatoes and citrus foods. So they definitely can be aggravating factors. However, I would always look at the stress first and then begin to look at things like that as well. So, what are the things that we are prescribed when we have acid reflux? The classic proton pump inhibitors, things like Nexium and other different forms of that. So, those are one of the biggest drugs that can cause such harmful effects, anything from dementia to Alzheimer's to kidney disease. There's been numerous links to other disease conditions, and it is something that can also completely decrease the amount of stomach acid. I just explained why it's so important that we have stomach acid. So if we completely deplete it, then we are affecting how we're actually absorbing nutrients and causing a whole host of other problems. So this is not the solution. The other thing that I did not mention is another cause of acid reflux can be a potential cause is what we call hiatal hernia. So a hiatal hernia is essentially when the stomach is being sucked up into the diaphragm, when there's essentially a weakness in the tissue that's contributing to it being pulled upwards, which again can cause a whole host of symptoms in addition to the acid reflux. I find this quite frequently, and people that have COPD and other breathing issues, there's a strong link. That is something that I always assess and am able to treat as well pretty effectively. So again, proton pump inhibitors are ideally not the solution. So I'm going to suggest a few things in terms of how you can begin to look at this. So the first thing is, of course, eliminating the obvious food triggers. Things like citrus, tomato, fatty foods, fried foods, all of those. That's kind of an easy no-brainer. If you're smoking, if you need to lose weight, all of those things are again, important. But the other thing is going to be to assess if you have low stomach acid. So to do that, what you would do is you would take 350 to 750 milligrams of beta-ine hydrochloric acid. So it's an over-the-counter, well, you'd have to seek it out online, but it is a supplement that you would take, which is basically your stomach acid. So in a normal, healthy person, you would take the supplement with a protein-containing meal. If you have symptoms, if you have heartburn-related symptoms, that would be considered a normal response. If you do not have symptoms, then you would continue taking the supplement before protein-containing meals, and you would slowly increase that over time. This is not something you do forever, as you continue to eat your protein meals. So again, if you have a response where you have symptoms, that would indicate that you do not need to take this. And if you do not have symptoms when you take this, then that would indicate that this would be a likely path for you. Of course, please check with your physician or your health practitioner, whoever you're working with, to make sure that this is appropriate for you. But that would be one option for assessing, self-assessing, if you have low stomach acid. In addition to that, so the hiatal hernia release, I'll just kind of explain this. So this would be something you would do on your back. You can do it yourself. So if I was doing it on a patient, I would be manually doing it. But basically what you do is, one way to assess it, and this is not the only way, but you would feel on the lower ribs here. So you would kind of go right on your bottom ribs, and you would take a few breaths and see if your left side is moving. If it's not moving very well, and you're having all these other symptoms, there is a chance that this is a possibility for you. So the lower, what we call lateral ribs, side ribs, should move, should expand. They should expand like a bucket handle as you're breathing in. So that would be one assessment technique. A treatment technique is where you come underneath of the rib cage here, okay? And you would place one hand, it's great to do this on skin, place one hand, and then you can place your other hand just gently on top. And what you're doing is you're pulling the tissue down. So I'm putting contact with my skin and then pulling the tissue down. And you're gonna hold that there until you sigh, swallow, or yawn. It is a super effective technique. I've had many patients and clients do it if this is a symptom for them, and they have been very successful, coupled with vagus nerve and breath work, and of course eliminating some of the probable food issues. So simple, very, very simple technique. It's not going to hurt you. So the great thing is that you can see how you respond to it, and if you have a positive response, that's great. Sometimes if you're having current symptoms that, at the moment, wait till things settle down a little bit and then you can try it. And you can do it on a regular basis until symptoms begin to resolve. So that's it. If you have any questions, feel free to comment below or email me, DM me, whatever is easiest for you. I hope that helps. Again, always check with your physician, make sure you get appropriate testing, and if you're taking any medications, you just want to make sure all of that is safe. But I hope that helps. Okay, thank you. Have a great day.